Hello and welcome to another COVID-19 update. Today we are speaking with the Honorable Minister of Health, Dr. Frank Anthony, and he will be giving us some updates with what's going on in the health sector regarding COVID-19. Minister Anthony, thank you for joining.
Thank you very much for having me.
So, Minister, we're going to get started right away. We want to talk about we had 3 deaths yesterday, and more deaths are being recorded as the days go by. And we want you to put into context, the reason for the number of deaths, so much deaths within a short period of time.
Well, the disease itself, while we'll have maybe about 80% of the persons having a mild form of the disease, we'll have maybe about 20% that would require hospitalization. And of those persons who require hospitalization, probably about 4% or so would require ICU care. And those who would require ICU care, generally they are very critical. And in terms of the treatment that we are offering, we will provide the best that we can offer right now. But unfortunately, we lose some of those patients because there are various challenges with treating this disease. Unfortunately, yesterday, we lost 2 persons at the Georgetown Hospital. Again, one was an older gentleman, about 74 years of age, and the other person was a lady who was in her 40s. We know that older people are vulnerable to the disease because apart from their age, they have various comorbidities. And in this case, I think the severity of the disease with these additional burdens that a person had would have resulted in them not being able to overcome the COVID-19. In the second instance, with the lady, we had expected her to do much better, but unfortunately she didn't. And so we lost her yesterday. The third patient that we had was someone from Region 9, and that person had passed away a few days before, and we only recently was able to get the test results. So that's why we had 3 deaths being recorded. But, the team at the Georgetown Hospital and at all the regional hospitals will try their best. They have been trained in understanding the disease clinically and how to respond to the disease. So I want the public to understand that from a treatment point of view, from a clinical point of view, that we are doing all that we can at this present moment. But unfortunately, as with other places where this disease has been, we will see deaths because it's the nature of the disease.
Okay, Minister, and in you saying, we're talking about understanding the disease, FAHO WHO, the country representative, he has recently spoke about persons being cleared of COVID-19 without the need to be retested and all that. Could you elaborate a bit on this?
Again, when somebody is tested, so if that person is positive, we would monitor that person for the first 10 days. If they're symptom-free, we continue monitor them for another 3 days or so, and if they remain symptom-free, then we would discharge them from our isolation facilities. Isolation facilities meaning whether they're in institutional isolation or in home isolation. There's no need for another test because all the guidance that we have received from PAHO WHO has been for maybe about a month and a half now that there's no need for a second test. We have incorporated that into our guidelines, and that is what we have been using. I know some people, out of abundance of caution, would like to get a second PCR test. This is absolutely unnecessary. And if you try to do that, what you'll be doing is clogging up the system. Because one, you don't need the tests, and secondly, persons who really need the tests, you are now creating a backlog for them. So we'll urge people, once you observe the isolation, that after 13 days, really, you can be discharged if you have no signs and symptoms. If you do have signs and symptoms, you will be monitored, and we look at a 3-day symptom-free. So once you have been free of symptoms for the last 3 days, then a decision would be taken whether you can be discharged from isolation. So generally, the trend has been that after 13 days, most people can be discharged without a second PCR test.
Okay, and in being discharged, that obviously means that they would not be able to transmit the virus anymore.
No, they're not. They're not infectious, because we wouldn't want somebody who's infectious to be put back out there in the public. So the reason why we have this time frame is to ensure that the person is not infectious.
And that is what is important to note, because people will be concerned that, a positive case is being, yes. So that's what's important. Thank you very much for that.
And there's another little bit of thing perhaps that I can explain. Because more and more we are seeing that some institutions are offering testing, but the testing that they're offering is an antibody test. What we offer at the national lab, National Reference, Public Health Reference Lab, is a PCR test that tests for the virus itself. So once you have the viral particle in you, we are able to detect it using the PCR. Now, because we are detecting the virus, that is what we call a diagnostic test. So we will be certain that you do have this virus, right? Now, some of the tests that are offered in the private institution are not PCR tests, so it's not diagnostic. And what is offered sometimes is called an antibody test. Now, you will have to wait, at least if you have been exposed, you'll have to wait maybe about 12 to 14 days or so before your body actually develops these antibodies. And at that point in time, then you will probably test positive on an antibody test. So that is not really sensitive enough to detect whether a person has been infected with COVID-19. So I want the public to understand that there are two broad types of tests that are available. The PCR one is used as the diagnostic test. It is what we consider as the gold standard. And if people really want to know whether they have COVID-19 or not, the preference is for you to do this PCR test. There are some other types of tests that test for an antigen, which is the virus again. They're very quick, but we don't have them at this moment in Guyana. So what we have is these two broad categories, PCR, antibody. PCR is diagnostic, antibody is not. And therefore, if you do a PCR and you're positive, and then you go and you do an antibody and you're negative, that does not mean that you don't have the virus, right? The first one is the one that is most accurate.
So, Minister, as we're on the note of testing, can we address the clearing of the backlog? Where are we in clearing those test results, and what time frame are we looking at when we get to the point of receiving when can we get to that point of receiving results, same day or within 24 hours and things like that?
Well, we have been doing a lot of things to try to build the capacity of the National Public Health Reference Lab. So we have done the training, we have more people now, and right now we are trying to get more machines so that we can have extra capacity. We have ordered an automated machine, and we are working with the manufacturers to try to get that as early as possible into Guyana, because that would help us to clear a lot of the backlog that we have. But even while we await on that, one of the things that we have done is to talk to CARFA, and on Monday we'll be sending across to CARFA 500 samples so that they would be able to test it in Trinidad for us. We have a special flight that is coming in to Guyana to bring some COVID-19 supplies, and we'll be sending out back 500 samples for them to check. So this would help us with the backlog. But again, our challenge has been that a lot more people are coming forward to be tested. And as more people come forward, as fast as we clear the samples that we have in the lab, we are bringing in new samples. So, you know, unless we add more capacity in terms of more machine and so forth, it is going to be a challenge in the near term.
Okay, and the tests that are going, the test samples that are going off to CARFA, how long would it take before it gets back?
I'm hopeful that within a 24 to 48 hours that we can get those results back.
Thank you for that, Minister. And what about the status of the other equipments, the ventilators and so on, that's supposed to be coming for the regional hospitals to build their capacity?
Well, as you know from the grant that we got from the Indian government, part of it we have been using to procure 29 ventilators. We were expecting all of it to have arrived during this week. Unfortunately, we have some of the material that came in, and by early next week we'll have all the others. So I would guess by next week we should be able to have those ventilators, all of them in the country. And once we have them, we are going to distribute them. Some would go to the Georgetown Hospital at the infectious disease ICU that we have there, so that we can have more ventilators there. And we have already started talking to the various regions, and we have commenced training for the doctors in those regions, so that when these ventilators come and they go out to the regions, we'll have trained and competent people to manage them.
And we know that in building these regional ICU capacities, it will take a load off of the GPHC's ICU's capacity, because we spoke to Dr. Jeffrey and he explained to us that the hospitalization rates, it is somewhat increasing and it's often a burden on the GPHC. Can you just expound a bit on that, Minister?
Well, one of the precautionary measures, I would say, that the Georgetown Hospital would have put in place is that almost every patient that comes into the hospital, they try to check them for COVID-19. And because of past experiences, when some of the patients who were hospitalized, they weren't that diligent, and they turn out later on to be COVID-19, which entailed that a substantial percentage of the staff that would have worked with those patients had to go into quarantine. So they have adopted a new protocol where they try to check as much as possible all the patients that come in. And because of that, there are challenges in terms of making sure they get the test, and once they get the test, then they will be able to sort out the patients and so forth. Now, because of the limited bed capacity at the hospital, that can pose a challenge if you have people coming in at a faster rate. And that is why during last week, we have made concerted efforts to now put some of those patients, or the intention is to get some of those patients to the Ocean View facility. So last week we spent quite a lot of time looking at the facility, checking the needs to see what else we need to put in there. And we would not be able to start the entire hospital because there's so much more that needs to be done. But we are going to start sections of the hospital. So we have right now completed an area for 55 beds where we will be able to isolate the mild patients, persons who have tested positive for COVID, but they have a mild condition. And we have a section of the hospital where we can accommodate 55 patients. So we have recently bought those beds and bedside cupboards and all the things necessary for that. That has right now been installed at Ocean View. Um, Another section of Ocean View would be used for patients who are in the obstetrics ward, some of those patients, and that section would house about 47 persons. So right now, that's what we are trying to finalize. Our challenge up to yesterday, and I hope that we'll be able to resolve that today, has been electricity to the building. The electricity to the main power supply was not connected. Um, I've asked the ministers responsible for both electricity and water to assist, and I must say they have been very responsive, and they have spoken to their technical staff. So I'm optimistic that we'll be able to get electricity into the building today. We had to put in transformers and things like that. So I'm optimistic that by today we can have those in. And GWI and the staff of GWI has been working with us very diligently to put in the water supply. Once we can have that completed by today, we would start using the facility as of this afternoon. And so that whatever constraints Georgetown Hospital has been experiencing, that we'll be able to take off some of that load at the Ocean View facility. So this would be an immediate measure, but going forward and how we have organized it, these patients would not be in contact with other sections of the hospital. So while they are housed there, we can, if necessary, go and finish off the civil works that are needed in other sections of the hospital. So we had a technical team that analyzed it. So basically the two areas, the 55 beds and the 47 beds, they would be more or less in a self-contained area and would not be interlinked with other sections of the hospital, right? So that allows us the time and the space to safely finish off the other sections of the hospital.
Okay, Minister, and in finishing off the other sections of the hospital, is there like any other plans, maybe medium, long term for that, for those other sections, what you want to do with it?
We'll have to get the additional budget to complete it because there are substantial works to be done. While the original intention was to have probably about 100 beds in ICU space, right now that is not possible because they don't have gas lines and the other things that are necessary. And for us to install those, it's going to take some time, and we have to see how to put them in the appropriate places. The technical people were telling me it might entail some additional civil works, but I would have to get a proper report before I make further comments on that. But there's still a lot of work to be done. There are sections in the building that we would be able to do surgery if it's necessary, but the theater and the surgical space and so forth has not been properly set up. The building also would have space to do x-rays and other forms of diagnostic testing, but again, equipment and all the things necessary are not set up as yet. So it would take some time for us to get it fully functional, but in the meantime, and for the immediate needs, the things that we want to do right away, we would be able to get it working, and hopefully by this afternoon we'll get that going.
So, Minister, while that is what is being done to ensure institutional isolation is up to standard, we know that other institutional quarantine facilities, there are those out there, and I'm sure there are others in the regions. Can you tell us broadly how are you seeking to probably improve those facilities or do more?
In every region, we have isolation areas and we have quarantine areas. And maybe just for the public's understanding, a quarantine area is a place where we will put you and observe you for at least this 7 days to see whether you develop any signs or symptoms of COVID. And the reason why we put you there is if you have been in contact with someone who is tested positive, right? So that's why we use the quarantine areas. So this is somebody who hasn't tested as yet, don't know their status, but we are waiting to see whether or not anything develops. We have two types of quarantine area, those that are institutional and those that are self-quarantine, meaning that you can stay at home and observe the same rules, right? And we believe that when people do that, they feel more comfortable being at home. And if we can get them to comply properly, then I think that works for everybody. Because sometimes when you try to get somebody to come into the institutional quarantine, they feel very uncomfortable in doing that. But when we allow self-quarantine, we have to make sure that people are abiding by the rules. Similarly, we have isolation facility. An isolation facility is used for persons who have tested positive, right? So that's the main distinction. Quarantine, the person wasn't, we don't know their status, but they were exposed. In the isolation area is someone who is tested positive. Now, again, we have two types of isolation area, if you like, institutional, and we have those that we allow to stay at home. So persons, there have been a lot of asymptomatic persons who, when they did the tests, they were positive, and we have allowed some of them to stay at home because when we did the assessment of their home environment, they had the means of staying at home and isolating at home. Persons who do not have the means of doing that, we'll then bring them into our isolation facility. In every region, we have created these isolation wards. So almost every one of our regional hospital, they have a section where we can isolate people. Now, what we are now trying to do, in addition to the general beds that we have in each one of these regional hospitals, we are now adding infectious disease ICU beds, so to speak. So that one of the challenges that somebody who is tested positive, they can have very mild signs and symptoms and then rapidly deteriorate. And we have seen that in some of the patients because they were doing well, maybe just have a little dry cough or a little bit of fever, and then suddenly they deteriorated. And in those instances, they'll need special attention. They would probably need ventilation support and things like that. And that is why we are now trying to build the capacity of these regional hospitals. So in case someone who is in institutional isolation or even home isolation, if for some reason or the other they start progressing, so to speak, or deteriorating, their conditions deteriorating, then we'll bring them in to this infectious disease ICU, where we can provide them with additional care. So right now, our regional hospitals, they have the general isolation. Some of them have 1 and 2 ventilators, but that is not enough, and a lot of those ventilators that we have in some of the outlying areas are not working. So we have done an assessment. We know where we need to increase our capacity and what we need to do, the kinds of equipment that we need and so forth, to kind of bring those those infectious disease ICU to a basic standard. And so we are now working on getting the types of equipment to do that. So it has been a lot of work that has gone into this, and unfortunately, much of this should have been done before, but since it wasn't done before, we have to fix it. And
so I want to ask a follow-up question with regard to, you mentioned an assessment is done to determine whether a person can be self-isolated or institutionally isolated. In the assessment, what are some of the things considered or looked for?
Well, basically, they fall into two categories, I would say. One is to talk to the person themselves to get a sense of whether that person is going to be compliant, right? And if they are, then you know that they're going to follow the rules, then we can allow them. Then you do the second part of the assessment, which is their home environment. If too many people are living in the home, this person does not have a proper room where they can be isolated, then it's going to be challenging. Because if somebody is positive and you keep them there, the chances are they're going to infect the rest of the family. And so in those circumstances, it is better for that one person to come into one of our facilities and remain there for the duration of the period. So that's the basic way in which we assess. We assess the home conditions and we assess the person's and try to determine whether the person is likely to break the isolation or not. And I think with educating the person, talking to them, kind of counseling them and say, well, these are the reasons why. In most cases, I think people would abide by the rules.
So, Minister, I would like to move on to talk about the emergency orders which will be expiring on Monday, August 31st. What can you tell us about the possibility of probably an extension of these measures, and how is the President being advised currently with regards to reopening of the country?
Well, the orders, we are going to extend the orders, and the specific measures that are going to be in place, we are currently discussing some of those with various people. So we haven't finalized them, but certainly by tomorrow, we'll have a clearer picture on some of the specific measures. One of the things that we try to do, we analyze the epidemiological situation in each region and in specific communities. And if we see spikes in some of these areas, we then try to take particular measures for those areas. So it's a kind of disaggregated way in which we operate, in a sense that there's no one size fit all for the whole country, because different areas of the country would require different measures being put in place, and that's how we are approaching it.
Okay, and another issue I would like to touch on, the persons in the hinterland, they are using traditional medicine to recover. They say it's helping them to recover quickly. As health minister, what would you like to say about that, Minister?
You know, people have various beliefs, and it's perhaps sometimes hard to, you know, dissuade them that this is not working. In medicine, there's something called the placebo effect, where maybe if people believe that this is working, they can actually get a benefit from it. But what we try to do in the treatment that we offer, well, not try to do that, what we do in the treatment that we offer at our hospitals is to ensure that what is scientifically proven, that we use those guidelines to guide our clinical actions at the hospital. And that's one of the reasons why we have come up with standardized guidelines for treating COVID. Those guidelines have been out since last week, and we have been using those guidelines in every area where we are treating COVID right now. Last week, we also conducted training for the doctors in the outlying areas, and I think that went very well, and those guidelines have been circulated. So medical people basically would follow the science, and that's what we were trained to do. So once you come into a hospital, we will follow the best scientific advice and clinical advice in managing these patients. There probably is a role for traditional medicine, but we cannot advise to use it because we just don't know about the efficacy of many of these things that people have claimed would be working. So my advice to to people, and this would be the standard medical advice. If we don't have the evidence, if there's been no trial, like a randomized controlled trial, then it's not good to use it because we wouldn't know whether or not it's working.
Okay, so with regards to you spoke about the national treatment guidelines, and how does these reach out to persons who are self-quarantined at home and in terms of them being treated for COVID?
The persons who are quarantined, we advise them about the kinds of signs and symptoms that they should look for. And if they develop any of these, they should contact us via our hotlines. And we also have persons from the telephone bank who would be reaching out to them periodically to see how they're doing. So by getting that feedback, it's a two-way process. We reaching out, and if they develop any signs or some symptoms, they can call us. And we have medical doctors in that telephone bank. So if something clinical, one of the doctors can take over the case, walk them through, and if through that telephone screening, if they determine that this person is having some difficulty deteriorating or whatever, we send out a team to do further evaluation and to bring that person into one of our facilities. Similarly, with self-isolation, if the person start having signs and symptoms that is moving from mild to more moderate, again, before that person engage in this self-isolation, it's explained to them some of the things that they should look for, and if they do develop these things, they can either call us, so again, we can send one of the ambulances to pick them up and bring them into the hospital.
Okay. And Minister, we know that the ministry has been working closely in terms of receiving technical support from PAHO, WHO, and we're still in the note of treatment. Is there any talks about a possibility of a vaccine and how Guyana is being placed on that list to be among the first beneficiaries?
So we have been working very closely with PAHO, and PAHO was very instrumental in helping us to do a number of things, especially procuring test kits and other things that we needed for this COVID response. And they continue to be a very important partner in this response. In addition to that, the WHO and a number of other international bodies have come together, and they are promoting a facility called COVAX. Now, COVAX is trying to raise money so that they can invest in the vaccines that they think are promising. They're currently looking at about 15 vaccines that they feel would be very promising, meaning that they're right now in phase 3 trials, so there's only one more step to go. And because they believe that these things are going to work, that's why they have raised money, and they would invest in these 15 vaccines. If, say, 5 of that 15 works, then they will put additional money behind that 5 to get it to be manufactured, right? So this is a fast-track way of giving the scientists and the people working on vaccine the kind of financial resources that they need to get the job done. And once it is done and the vaccine proved to be working, then they can quickly scale up the manufacturing and be able to distribute these vaccines to different countries. Now, the aim of COVAX is to have 2 billion doses of vaccines by next year, by 2021. And so that's why they're working very hard to do so. We in Guyana, we would be part of that COVAX facility, and we would also benefit from a subsidy, so to speak. So we wouldn't get it at whatever price it is, but we'll get it at a lower price because Guyana and 9 other Caribbean countries have qualified for that subsidy. So we are going to be part of COVAX. So that's one area that we are pursuing in terms of a vaccine. Um, and this particular mechanism looks very promising because of the way that they're working it out and the amount of candidate vaccines that they're looking at and the amount of people they are talking about to scale up the manufacturing and so forth. So this methodology of using COVAX as the vehicle looks really, really promising. Um, so that's one mechanism. The second mechanism that we've looked at is we have had some bilateral meetings with the Russian government, and they too have been developing a vaccine. And I guess once we see the scientific information and so forth, and depending on the results that they're getting, that possibly can be another avenue to get a vaccine to Guyana. The third avenue is looking at the Indian government, and they have been conducting a lot of research through the Serum Institute. And again, they have a very good candidate vaccine, and we are awaiting the results of the trials that they're conducting. And I understand that they're looking at making about 1 billion doses as well. And they have set aside a portion of that for countries around the world. So again, in our bilateral engagements, we are looking at those possibilities. Recently, President Ali had a meeting with the countries in PROSUR, and we learned from that meeting that the Argentinian government is also looking at the development of a vaccine. They have been working with AstraZeneca and the University of Oxford, and hopefully once that vaccine is effective, that Argentina would get the rights to be able to manufacture some of these vaccines. And so the Argentinian government are looking at next year to probably have about 250 million doses being manufactured. And they are offering to PROSUR countries to be able to get some of the doses through that mechanism. That is something that certainly we will be investigating more and trying to see if we can have a bilateral with them. So when that comes on stream, that we'll be able to benefit from that arrangement. So in terms of vaccine, we are pursuing several options because we really believe that if we are going to exit this pandemic, that the only way to exit it is getting a very effective vaccine. Now, from the science world, some of the things that they've been talking about, they're not sure whether you might have to get 1 dose or 2 doses, whether some vaccines might be more appropriate for older people versus persons with, comorbidities and all of that. But as the weeks and months go by, those things will become much clearer. But I want to assure you that we are doing a lot of work in these areas to make sure that when a vaccine becomes available, that we too would benefit from a vaccine.
Excellent. Thank you very much for that, Minister. And as we prepare to wrap up, is there anything else that you would like to add? And as you're on that note, we cannot continue to stress the need for persons to be more compliant with the orders, given that it will be extended and so forth. So can you also please touch on that while you add your closing remarks?
Well, a couple of things that I want to identify. We have a telephone bank and hotline, so to speak, and people who are sick or who want to have information would usually utilize these lines and call in so that they can get information. But we noticed that there are persons who would just call in prank calls, and it's unfortunate because what that does, it ties up the line, so somebody who really need urgent care or urgent advice is not able to get it because people are just calling and with these crank calls. So that's something that we hope that we can get the public to desist from doing that. If you have an urgent case or you really need some information, please call. We don't have a problem with that. but don't do these prank calls because it's just tying up our lines. And secondly, if these things persist, then we have the ability with the telephone companies to be able to trace those calls, and we will, ask the police to go and enforce the law, meaning to prosecute those people if they persist. So we just want to sound the warning that desist from these calls because you might be preventing someone who really need urgent information, and you might be hindering us from saving a life. So we really want people to desist. And of course, as you know, we have been out there trying to get more people to comply by wearing their masks, keeping their social distancing. And we want to emphasize that again because the preventative aspect, uh, if everybody play a role in the prevention of this disease, then all of us would be safer. So if each one of us take on the responsibility, then we'll get less transmission, we'll get less hospitalization, and we'll get less deaths in our hospital. So we each have a role to play. We might believe that, we are young and healthy and we don't have to comply with this or comply with that. But maybe there's somebody in your home who is older, who's vulnerable, and you might get it. You might be asymptomatic or pre-symptomatic, or you might have mild symptoms, and then you take it into the home and you infect somebody who is more at risk, and that person, would suffer badly. So, we have to take on this thing seriously, and unless we get a vaccine or, that we can use, it's going to be here. So we have to learn to adopt the preventative measures and take precautions. And I think if more people start talking to others, their friends and families about this thing, and even when people try to get close to you, if you tell them about social distancing, if you tell them about mask wearing, I think it would help to get that message around, because this is the simplest way that we can prevent COVID-19.
We do appreciate you taking the time out to share with us these updates while you give your views on how each Guyanese could play their part in stopping the spread of coronavirus. Thank you, viewers, for watching. We have been just talking with the Honorable Minister of Health, Dr. Frank Anthony, and he has shared with us COVID-19 updates. Do look out for more updates as we continue. Thank you.